So you want to know, how can a DVT hurt me? Well, this video is all about DVTs and whether or not they can hurt you. Welcome to HEALTHdrum. I'm Dr. Bert Vorstman, a urological surgeon and former researcher, and this channel is all about routine medical conditions, self-care, and digital health, so you can be informed and in total control of your healthcare needs. If this is your first time on the channel and you like to get fact-based healthcare information, please hit the subscribe button for me. It's free. By the way, HEALTHdrum is for educational and informational purposes only and not a substitute for professional medical advice. The links to the disclaimer and the material in this video are in the description below. Okay, let's get into it and sort fact from fiction. So what is a DVT, or deep vein thrombosis? A deep vein thrombosis is a potentially serious condition that occurs when a blood clot forms in a deep vein, and usually in one of the leg veins. It is associated with some risk factors that we will discuss further along, and a potential complication of this disorder is a piece of clot coming off and blocking an artery to the lungs. This is called a pulmonary embolism and can be fatal. Where in the body can you get DVTs? So deep vein thromboses commonly originate in the deeper veins of the legs, but they can also form in the femoral or thigh vein, the armpit or axillary vein, in the pelvic area, in the abdomen, and also in the brain. So what risk factors can predispose you to having DVTs? There are several risk factors for developing DVTs. A lack of movement is a common cause, such as sitting for several hours on a long flight or lying on an operating room table for major surgery. There may also be a family history or certain genetics. Cancer, obesity, or older age, and fractures are risk factors. As well, there's polycythemia vera, a condition where you can have an excessive amount of red cells making the blood thick. And recent childbirth or taking medications such as birth control pills or hormone replacement are all risk factors for DVTs. So what are the symptoms of a DVT? So these are some of the symptoms that can be seen with a DVT. You can complain of leg, arm, or abdominal swelling because the blood clots are holding up the flow of venous blood. There may be leg cramps, associated discomfort. You can have redness over the calf, or the area may be warm to touch. If the clot is in the brain, you may have headaches or confusion. So what are the signs of a DVT? The sort of signs that could suggest a DVT are swelling of the legs, usually in one leg, shortness of breath, coughing up blood, chest pain, rapid breathing, rapid pulse, and if in the brain, lightheadedness or feeling dizzy. And if you have any of these signs, seek medical attention immediately. So how is the DVT diagnosed? So a DVT is diagnosed by clinical evaluation and assessing symptoms and signs as discussed above. As well, there are tests such as an ultrasound of the calf veins, as DVTs commonly arise in the lower legs. There are also other radiological studies such as venography, CAT scans, or MRI. And then there's the D-dimer blood test. The D-dimer blood test measures a protein fragment called D-dimer, which is released when blood clots break down. And there's also the antithrombin 3, protein C, and protein S levels. And when these are low, you can be at risk of having DVTs. How are DVTs treated? Normally, for DVT treatment, patients are started on heparin and move over to direct oral anticoagulants such as warfarin, Eliquis, Xarelto, or others after several days. Rarely thrombolytic treatments or clot busters such as streptokinase or others may be required. Also rarely, there are procedures for clot extraction, stents, or placement of a vena cava umbrella. And the length of anticoagulant treatment is usually about 12 months or so to minimize the chance of recurrence. How is anticoagulant treatment monitored? The monitoring of heparin treatment is done through measuring the activated partial thromboplastin time and an ideal activated partial thromboplastin time is considered to be between 25 and 35 seconds. For warfarin, it's the INR, or International Normalized Ratio, and for people taking warfarin, the therapeutic INR is usually somewhere between 2 and 3. So how often should you get INR testing? When you first start on warfarin, you may need to have blood tests every few days or weekly. When your INR and warfarin dose are stable, blood tests are often done every 2 to 4 weeks, sometimes less frequently. And if your warfarin dose changes, you may need to have your INR tested more often. On the other hand, some oral anticoagulants may not need monitoring. What are the possible complications of a DVT? There are some potential complications of a DVT. The most important is the pulmonary embolus, which can be life-threatening or fatal. Some patients can get post-thrombotic syndrome or persistent leg swelling due to chronic venous insufficiency, as well as leg ulcers and/or infections in those ulcers. Also, there may be complications from the anticoagulant treatment itself, such as bleeding. Now, if warfarin is responsible for a bleeding episode, such as seeing a lot of blood in the urine, its effects can be reversed with vitamin K or fresh frozen plasma if severe. And how is a pulmonary embolus diagnosed? A pulmonary embolus diagnosis is made initially through clinical evaluation and noting such signs as shortness of breath, rapid breathing, and rapid pulse, and then confirming suspicions with tests such as the D-dimer blood test, ultrasound studies of the lower legs, as this is the most likely source of the pulmonary embolus, and a ventilation perfusion or VQ scan of the lungs, and possibly a CT pulmonary angiogram. How can DVTs be prevented? DVTs can be prevented by using compression devices during surgery on the calf veins and following post-surgical guidelines. Otherwise, movement and exercise on long flights is important. Also helpful, making good lifestyle choices, maintaining a healthy body weight, fitness, stopping smoking, avoiding dehydration, and using compression stockings are helpful. So what is the prognosis after a DVT treatment? The prognosis after being treated for a DVT is generally good, and most recover fully. There is a risk of post-thrombotic syndrome with chronic leg swelling, especially in those that have had more than one DVT, and there's always a risk of recurrence of the DVT. As well, there are other chronic health conditions and blood disorders that can impact your prognosis after treatment, so check with your doctor. So let's recap in this video, can a DVT hurt me? You learned that the DVT is a potentially serious condition, that it can be easily treated with anticoagulants, and that it can be easily prevented. To learn more about routine medical conditions, self-care, and digital health, check out these other videos.